Woman 90 dies after being infected with two strains of COVID at the same time in the first case of its kind. A pensioner who died after contracting COVID 19 had been infected with two strains of the virus at the same time, researchers in Belgium have revealed. The 20-year-old woman had contracted with both the UK and South African variants at the same time and is believed to be the first documented case of its kind. She has not been given a vaccine and was admitted to the OLV hospital in the Belgian city of Aalst after a series of fails in March. The woman, who lived alone and received at home care, tested positive for coronavirus on the same day as her admission to hospital. Initially, her oxygen levels were good, but her condition rapidly went into decline and she died 5 days after being admitted. When medical staff tested her for variants of COVID 19, they found that she was carrying the Alpha strain, which originated in Britain, and the Beta strain, which was first found in South Africa. The case, discussed at this year's European Congress on Clinical Microbiology and Infectious Disease (ECCMID), shows that it is possible to catch two COVID 19 variants simultaneously. In a statement, the society said doctors believe it was first documented case of its kind, although rare. Similar dual infections are happening. Her doctors believe that she could have contracted the alpha and beta variations of the virus from two different people. Molecular biologist Annie Vannekerhem of the OLB hospital in the Aalst said both variants were circulating in Belgium. It is therefore probably that this woman was infected by two different people with two variants of the virus. Unfortunately, we do not know how this infection spread. The European Commission, the EU executive, has warned that it is expected the highly contagious Delta variant of the coronavirus to become dominant in Europe this summer, citing estimates from EU Disease Prevention Agency. Belgium, like much of the European Union, faced vaccine delivery problems early in 2021 and its vaccination program started slowly. Although the European Union has now delivered vaccines to cover 70% of the population. Since the pandemic began, there have been 1,93,700,000 infections and 25,198 coronavirus related deaths in Belgium. Of the population in the country, it is thought that around 51.5% of the population have been vaccinated so far. The research into the dual vaccination has yet to be submitted to a medical journal for publication, but has been presented at the ECCMID. Fagerben added that there have been no other published cases of co-infections but believes that the phenomenon is probably underestimated. She explained that this is due to limited testing for variants of concern and called for increase in the use of fast PCR testing. The Belgian case comes after two cases of double COVID infection being reported in Brazil in February after researchers at Fevale University swabbed 90 infected people in Rio Grande do Sul, southern Brazil. One of the patients tested positive for two Brazilian strains which evolved separately in different states known as P.1 and P.2, but no research has currently been published on the infections. Currently in the UK, the alpha and beta strains only account for a few cases, with PHE data showing a rise of 680 cases of alpha and 9 of beta in the week leading up to 7 July. The Delta variant, which is the most dominant in the UK, currently has 54,268 new cases in the last 7 days. Virologist and professor of molecular oncologist Lawrence Young said, this study does highlight the need for more studies to determine whether infection with multiple variants of concern affects the clinical course of COVID-19 and whether this is in any way compromise the efficacy of vaccination. Dr. John McWhorley, director of the Worldwide Influenza Center at the Francis Crick Institute, told Mail Online, getting one strain of a nostril and another of another nostril, doesn't matter. But if they get to the back of the throat and then go into the same cell, then there's an opportunity for this to happen. Thank you.